Okay, we are glad to join Dr. Gladys from the Conservation Through Public Health organization for our second Meet the PI session. While we chat with Gladys, anyone listening to the stream can ask questions in the chat, and we will check and ask questions to Gladys directly. So Gladys, first of all, and again, thank you for this wonderful presentation. It was very inspiring. And let me start maybe with one question. So you do your research, you need money for this, and you also help the local community to improve their health and gorillas protection. And I was wondering, how is it hard to find this money? Or is it more and more hard to find this? Or is it not that bad and you still have help to help the community in your program?
It is not easy to fundraise, also because we're doing something that's non-traditional. Most people are used to funding either conservation alone, or public health alone, or animal health alone, or human health alone. And so because we're combining everything, it's a lot harder to find funding, especially at the beginning. And most donors are used to single sector approaches. So there was a lot of educating the donors to understand why we need to do it holistically. If you only improve animal health without human health, or human health without animal health, diseases can still jump back and forth and you don't have a long-term solution. So that's been difficult. But we're glad to have got some donors who understood what we're doing and wanted to support us, early adopters. Like, actually, I would say the Irish government gave us some support early on, and we started the improving TB prevention and control in communities that interface with gorillas. And then one of our other early donors was the John D. and Catherine T. MacArthur Foundation. They also came on board pretty early on, and USAID also kind of, because they already had like a integrated population health and environment program that they were supporting NGOs in Madagascar to support community-based family planning around protected areas. But they were happy to add that onto the model that we had that was preventing zoonotic disease transmission through service delivery and behavior change. So it was all very much educating of the donors. And there've been a number along the way, including Darwin Initiative. I think they took some time to buy into it, but when they did, then they put out a call saying health approaches to conservation are also welcome. So there's a lot of education of donors along the way.
For sure. Oh yeah, sure, for sure. And I was also wondering, is it also hard to find people to help you, like in the local community or other students or researchers?
I would say that in the local community, we had to convince them to be part of the solution, and we empowered them with skills. A lot of them could now talk confidently about health issues, conservation issues, and that really raised their self-esteem. And then they became our champions and our model change agents in the local communities. So I think rather than giving them handouts, like saying, here's handouts only last for a short time, rather we gave them skills and we got them to lead a lot of the efforts. So over time, we've developed a community-led conservation approach to a community-led approach to conservation, through improving community health and well-being and conservation education and attitudes. So we get them because it's easier for them to convince their community than somebody from another country or even from another town. Sure. Like, I come from central Uganda, near the capital city, and Bwindi is like 10 hours drive away. But it's easier for someone from Bwindi to convince someone than someone who's come all the way from Kampala. And so that's kind of why we would rather work with them. I don't think we'll be able to reach 10,000 homes if we just had a staff, because first of all, it would be very expensive. But through 430 volunteers, community volunteers, we're able to reach so many people.
Sure, that's a lot of people. So
we're really glad that actually National Geographic has helped us with the model household approach, so that we're able now to better measure how we're changing homes, model households through the One Health approach. But yeah, I think the COVID pandemic really helped us, I have to say. in a way, it was a bit of a silver lining, because people came to me and said, now we know what you've been trying to do all these years, and so they were like, because, we still don't know where COVID came from, but it's obvious that it's jumped from people to animals, animals to people. So most likely it came from the Wuhan wet life market, but they're still trying to prove, trying to get the proof that it did come from there. It was all a big issue of animal welfare, very bad animal welfare in the market. Animals got stressed, viruses was jumping back and forth amongst animals, between animals and people, now among people. That's where most likely it came from, but it still needs to be proven. But still, we're seeing COVID jumping back and forth between people and animals. And so people are like, okay, now we understand what you're trying to do. So I'd say that the One Health approach, addressing human, animal, and environmental health together, came into maturity during the pandemic. Everyone now understands it a lot better, because we don't want another COVID. I mean, everybody was affected, nope. The whole world, not just the third world countries. So I think people stand up and think, whoops, we need to do something about pandemics.
Yes, I think AB has a question.
Yeah, let me just unmute myself. I think I had a question related to something you briefly touched upon during your talk. So in one of the pictures you showed, you talked about this person who had some negative experience with the gorillas, right? And he was like, I don't care if they are dying out. So how often do you face, like when you go out and talk to the community, how often do you face situations where they are very resistant to what you're trying to say, and does it escalate, or how do you deal with such situations?
Yeah, it can be quite tricky, but I think you meet them where they are at. One time, I think I showed that photo of a destroyed banana plant, and this farmer, I mean, he wasn't even a farmer, he's just a regular person. And many people, because banana plants as a staple diet here in Uganda, so many people plant banana trees in their garden. So the time that we went to his garden, the gorillas had just been there, and it's the most popular tourist group. So he said he was very upset that the gorillas had destroyed his banana plants. So I said to him, do you like gorillas? And he said to me, I said, do you think gorillas are important? And he said, and we should preserve them. And he said, yes, because my children are employed by the park, and some money from tourism is shared with the local community to build schools, clinics, and roads. But the individual person like me, whose crop has been destroyed, I'm not being compensated. And yet they're bringing tourists to view gorillas in my garden. The tourists are paying the government money, and I'm not getting anything. And they're destroying my crops. So I felt really bad, and I gave him whatever I had in my pocket at the time, about $2 equivalent. And later on, I spoke to my bosses and my supervisors, and they said, and he became one of the leaders of the Human Gorilla Conflict Resolution team that herds gorillas back when they come out. Because we all felt that instead of making it the rangers who do it, let the communities have some power over their situation. And gorillas are very intelligent. Like, they expect rangers are the ones who go out to look after them. And then if the next day they're being hostile to them and herding them back, they'll be getting mixed messages. So it was decided it shouldn't be rangers or vets to herd gorillas back. It should be people from the community where they shouldn't be. And these people should be empowered to do this and be supported. So I think it's really worked well, because they haven't dropped out for years. And they're proud of what they're doing for their community. But it's like making them part of the solution to this problem. I think, whether it's elephants, whether it's, raiding people's crops, getting community members to dig the trenches that stop elephants crossing, or to plant, to put up beehives because elephants are scared of bees, whatever it is, as long as and then they earn a living from the honey, just all those kind of interventions where actually there's a part of Burundi that has a buffer zone. And it's the only place with a buffer zone which has people planting trees, tea, and through that they can earn from the tea. And with us, with coffee, we find that gorillas don't really like coffee anyway. And that crop enables them to be able to earn a good living, so they don't have to enter the park to poach. So it's just finding a way that they're part of the solution to their problem, and not thinking you're just a person who can address it without them being involved. But yeah, it can be quite tricky, actually.
Yeah, I think Natasha has a question.
Yeah, I really like this community approach that you're employing because it seems to be super successful at resolving conflicts. But then I'm wondering, does it only work at a local scale? Like, and what's the limit of this approach, do you think?
Thank you. I'm glad you like it. I think it works, it will work well locally, and it can also be scaled nationally and globally, because that whole method of human gorilla conflict resolution teams, it's been taken to other protected areas in Uganda where there are no gorillas. They call them community scouts, but it's still the same principle of getting the community to be involved in solving their problem. I know everybody feels strongly they shouldn't be given a salary, but they're given incentives like livestock, or, they give them training in various things. The only reason why they're not given a salary is because then they become staff, and then you have to pay taxes and all that. And it no longer becomes a community movement, but instead it becomes you're just paying people to do a job. And so I know that there was a Peace Corps volunteer, Francine Madden, who helped to set up these groups. And she took that approach to other countries where she went, because after she left Peace Corps, she worked with NGOs, and she tried to take that same approach to other countries. So I think it can work and be scaled up at a larger scale, because the government cannot resolve human-animal conflicts, human-wildlife conflicts alone. They need to work with partners, and the best partners to work with is the very people affected by the conflict.
I have a question. Oh, sorry, Natasha, you can go.
Do you have practical tips for us if we wanted to implement something similar for conservation programs, for instance?
Yes, I would say that championing the One Health approach to conservation is a very good way to get communities engaged, because the most controversial issues among communities is conservation and family planning. And so when you bring in the issue, or that you care about their health, because healthcare is a basic human right, and you care about the health of their animals, their goats, their cows, you show that you're caring about something that's dear to them, then they'll buy into your conservation approach. So I would say that some of the practical tips are basically, one thing we did is actually we met them and talked about what the issues were. And we talked to them about how we think they could be. They came to us and said, yeah, we'd like to be part of the program, but when you're selecting it, let's select one person from each village. Let's not get the person watching someone taking medication every day for 8 months to be the one who then offers family planning services. They said, let it be one person per village. They should be able to read and write. So you make them to be part of how to solve that problem, whatever problem it is, and then let them lead it and help them to lead it, because it's very sustainable, rather than you're the only person who has the solutions, and your solutions probably will not even be best for them. You have to get them to come up with the solutions and then support them in that way. And I think it can really work everywhere you go. It doesn't matter which type of community it is, you have to buy their trust and respect. And I would say, because they have the best answers for their problems. It's not us, it's them. And just getting them to buy into what you're doing and see how they can solve it, getting them to become the solution to their problem. And it's all a way of saying, look, it's a win-win. We want the gorillas to remain healthy, but we know, and it's very important for you to remain healthy. How can we work together to make this happen? And that's kind of how we took that particular problem to them.
I think David has a question.
Yes, I don't know how to raise my hand on this. I was going to ask, how has the program improved life for the people, the local communities? I mean, how would you characterize the changes that they have seen in terms of health and in terms of prosperity over the period?
Thank you. I would say that we've really seen a lot of changes over time. We've seen that over time, community members, first of all, we're seeing less and less temporary houses. More and more people now have, they've moved away from mud and water house with a grass thatch roof to proper, like more permanent houses with iron sheet roofs. We've seen an adoption of hand washing stations from like 10% to as much as 75%. because people, and it's them who do it themselves. We don't give them hand washing stations. The government has this very simple jerry can. You press a pedal and the water comes out and you can wash your hands. So they adopt it because they realize actually it's going to reduce diseases in their family. And, hand washing reduces all kinds of diseases, including COVID. So they have to accept that it's a good way to go. And we've seen over time, people adopting, like drying racks. They are getting more. We've helped them to develop ready-to-grow gardens. So currently now we've supported 3,000 homes with ready-to-grow gardens, and they're able to have fast-growing seedlings that can grow within 1 to 4 months, and they can eat, so that they don't, the money they earn from tourism doesn't go to buy food, but it goes to support like paying school fees for children or other household needs. So I think our approach has basically improved community health and well-being. And because of that, when gorillas go into their gardens, they're much more willing to protect them. And in fact, Kanyonyi, the gorilla that I talked about, when his dad got too old to keep up with the group, because gorillas typically move about 1 kilometer a day, but when they get too old, they just can't keep up. He must have been over 50 years old. And so he decided to settle in community land. So when they called me, the Wildlife Authority called me and said, can you see if you need to translocate the gorilla back into the forest? When we went to check on him, it was the community members who told us where he was. He was in a community garden and hidden behind a shrub in the shade, and he was really comfortable there. And we thought that if we translocate him back into the forest, which is in itself is an anesthetic risk because he's getting old, he may find it hard to fight with the others because he prefers to be outside. That's why he's outside. And so we just talked to them through our community volunteers to tolerate him, to take up occasional banana plants, because he's done so much to change their lives. His group was a very fast gorilla group to be habituated for tourism and change the lives of the community forever. And so they went and told their community members. And when Ruhendeza died a few months later, they all came to pay their last respects because he was a legend who had changed their lives. And so it's a lot of finding different ways for coexistence. But the fact that the gorilla felt safer in community land just showed that because we're improving community health and well-being, they're more willing to protect gorillas when they come into their land. And that's really important because you're showing you don't only care about the gorillas and the other wildlife, you also care about them because healthcare is a basic human right. And I think a lot of conservationists come across as the wildlife is more important than the people, the trees are more important than the people, but you have to show them that no, they're not more important than you. And if we can work together, if you protect the trees, the forest, the wildlife, you benefit more from them. Especially if it really works when there's a lot of tourism, but even if there isn't, there's a lot of ecosystem benefits that you have from protecting a forest beyond tourism. And so it's basically you make them realize that it's a win-win situation. And I think that's the best way to go.
Right.
Thank you. From the way you describe it, I think it's such an important thing that and yet it is forgotten that the people in the community are so much part of the solution. And they are affected. They're the ones that are affected by their crops being destroyed or by things, the negative aspects of things. And for them to actually be part of the solution and be recompensed for their work is tremendous.
Yeah, thank you. Yes, they definitely need to be part of the solution. You can't alienate them from that. And because it's a longer term solution, it's more holistic.
Yeah.
And it passes down generations, because what's really interesting is because we're engaging schools as well, I think I mentioned it in my presentation, when we engage them in the STEAM program, science, technology, engineering, art, and math, we found that the children of the reformed poachers, the gorilla guardians, the village health and conservation teams knew more about conservation than the other children whose parents are not directly working with the park or affected by the park. And it's passing down the generations actually, which is great because those are the very children we want to change, so that their dads don't go back to the park, their moms care about wildlife, their moms care about animal health and human health, and yeah.
I have another kind of question for you. Like, with your presentation, your motivation are obvious to work with gorillas, and you're doing this since you are young. And I was wondering, how was it? Was it hard to be able to continue to do this work to your career? Was it hard to continue with your motivation is obvious, but were you able to do this? Was it hard or was it easy? I don't think it was easy, but how was it to be able to continue with this motivation to protect the gorillas, but sometimes it's not, like, you need more help, or like it's not always easy to do this, right? How you did this? Like, did you find this hard, or especially as a woman too, like it's not that easy sometimes?
Yes, you're right. I've also had many times when I felt like giving up, actually. Sure. Especially, it can get really difficult sometimes. But you just have to keep going, because I think every time I see that we're making a difference, you're seeing a community member waving at you, thanking you, people are excited to see you in the community, you think it's worth it. However difficult it is, it's worth it. And when you see that you're making a difference, when one time the Batwa who used to live in the forest but had to leave when it became a national park, one time we're having a meeting with them because we're training them to also become village health and conservation team members. And one time they said, we want to go into the forest as tourists and see the gorillas, and I just thought, okay, we're changing their attitudes, because they're the poorest in the community, but they're feeling that the gorillas are impacting them in a positive way now, even if they can't go to the forest anymore like they used to. And they even want to see them as tourists. And so those kind of things make me feel, it's worth it. And as the numbers of gorillas keep growing and we have new babies, like last month we had 3 new babies, and we're about to send out a newsletter. So all of that makes me feel like to keeping going. But it is difficult. And as a woman, I would say that when I started out, there were no female rangers, because it wasn't considered a job for female rangers, women to be out in the field with dangerous wild animals. And it wasn't just, it was a society norm. It wasn't the society norm in Uganda. And I think it's the same in many other countries in the world. Sure. And so everybody, they looked at me a bit strangely, but I brought a unique skill to the table. And so they accepted me more because of that. As I was the only veterinarian in the organization at the time. And when an animal fell sick, they had to turn to me. When they wanted to move animals, they turned to me. Sometimes you had to move elephants, giraffes for various reasons. And they just turned to me for different things. And so they respected me for that. And I never really noticed that me being a woman was an issue. It's only much later on that people said to me, I'm so glad you proved people wrong. A certain female conservationist, she was like a junior researcher, and now she's a senior researcher. And she told me that I'm so glad, because a lot of the guys would speak even in front of her that, who does she think she is? Can she really move animals? Can she really treat animals, which are so dangerous? And she said she's glad that I proved them wrong. But the thing is, if they had told me that 20 years, the time that I was starting out, I would have been so discouraged. But they didn't tell me anything. They were just smiling at me and calling me out when they needed help. But they were saying it behind my back. And now if they were to say to me, I wouldn't get discouraged. But at the time, I would have. So sure. I think maybe subconsciously, I gravitated towards people who were supporting me, and I gravitated away from people who were negative. There were a few people who were negative. I think I even mentioned them in the book, but eventually a lot of them, I won their support, or I just basically distanced myself from them. And I would focus more on people who were supporting me and doing their best to help me. And because I felt like I just wanted to make a difference in conservation, I wasn't so concerned about being a young woman at the time, but now I'm noticing, like I have inspired many young women to follow their dream of conservation, because they're seeing more role models. I've been inspired by people like Dr. Jane Goodall, and I'm so excited she wrote the foreword for my book. Late Dr. Diane Fossey, who sadly I never met, because by the time I got into conservation, she had died. I think she died when I was 15 years old or something, when I was still a teenager. But I did meet Dr. Birite Gaudikas, who went out and did the first long-term study on orangutans. She's really amazing as well. Both her and Dr. Jane Good, I've met them several times, and they're still very big powerhouses in conservation because they really influenced a generation of researchers, actually not just women, but men as well. And so it's good to have those role models because they help people to move. I really admire the late Professor Wangari Maathai, also someone I never got to meet before sadly she died. And there've been like a number of other role models in my life, but I also have to say that my mom has been a great role model for me because she was one of the first female politicians in the country and encouraged many women to join politics. She also wanted to continue my dad's legacy, and having a strong mother as a role model is really great because I saw how she was competing favorably with men, you know, at par with men in politics. And, you know, she became a member of parliament because she won the votes. You know, she keeps telling people I beat 8 men, and she's excited about it. So when you have a mom
kids, right?
that, you're like,
You have
yeah.
kids, you are doing the same.
I have
Because
2
you
boys.
see in the presentation, you are talking about one of your sons publishing in
Yes.
a journal.
Yes, I
It's
know.
nice.
Indigo was proud of him when he wrote that book, Zookeeper for a Week, and it won an award in America. And he's actually surprisingly great at giving presentations. And I think because he watches his parents, and so he's his little brother, Tendo. Yeah, so they have a lot of empathy, which is important because they've been going to the park since they were a few months old, and they've become very close to the children at Bwindi. They love to play football with them and various sports, and they've learned to have empathy for people who are less privileged than them, and that's really important because that's the way you can change the world, if you have empathy. And so they have lots of friends there, and they're always trying to help their friends. So it's great to have that support, and that the children are also becoming conservationists. They may not necessarily become veterinarians. Currently, my older son is playing college soccer in America. He wants to really get into soccer, and he tells people, I'm gonna earn a lot of money and donate to and my mom. I said, thank you. I have a ready-made donor here.
That's nice of him.
I have a ready-made donor.
So Natasha, you have a question?
Yeah, you seem incredibly skilled at convincing people, and I guess you're doing it through empathy mainly, and I guess through knowledge as well. Would you be able to pinpoint how you're doing it? What makes you so successful?
I would say, let me think about it. That's a difficult question. But I would say that it's important to be down to earth and not come across like you're superior to the people you're trying to convince. You have to meet them at their level and listen. You have to do a lot of listening, but also get them to, first of all, trust you, and don't become arrogant. A lot of people come across as, when people meet people who are poorer than them or less privileged than them, they assume that they know more than them. But sometimes it's the circumstances that led you to be in a better position than they are. You know, the family you're born into or the country you're living in. There are lots of reasons why some people are are better off than others. But it doesn't mean that these people aren't intelligent. I've seen the communities coming up with very good suggestions, like much better than I'm proposing for them, like in the very first workshop we had with them. And so that's one thing I've learned, to be humble and to kind of be down to earth and let people come up with what they think is important. And I think that makes a big difference. And it could even be just the government, because with the government, I know a lot of NGOs come to government and say, like, we know what's best for you, raise this money from such and such donor, and we're here to help you. And the government's like, yeah, but when I used to work for the government, my first job was with the government, they always used to say, these NGOs, they come to us, what are they really doing? Because they were not doing something that was a priority for the government. And they didn't really understand why they were doing it a lot of the time. So as NGOs, you have to, when we started our non-profit conservation through public health, we invited everybody, including the government, especially the government. And we told them, this is what we want to do with the NGO. Can you advise us on how we can do it better and how we can work with you? And they came up with better suggestions, even than more varied, because they told us things like, you need to work with traditional healers. We're like, wow, I never thought of that. And they said, yes, because they're the first doctor in the village. People go to them first before they go to the modern healer. And I was like, wow. And that's where a lot of disease transmission occurs. A lot of people would think that if you eat a game meat, bush meat, your child will get cured. And obviously, no, they were likely to pick up zoonotic diseases that can make them sick. So it's like, unless you work with people like that, the traditional healers, then you may not make much headway with community health. So I think there was a lot of things like that they brought up. And some of them also said, that there are no people treating the livestock in the villages, because there are very few vets in Uganda, even for livestock, let alone wildlife. And so you're like, okay, could you help to support livestock health? So then we help to create community conservation animal health workers and train them to do basic, deworming and basic stuff. And then they know when to call out the vet when it's a big thing. And then more money can be spent on that. But on basic stuff, they do a lot of livestock health and husbandry. And so all of that is something else that a lot of the times we get ideas from presenting things to people, and they tell us how we can do it or how we can improve on it, make it better. And so, yeah, that really helps a lot to listen to people if you want to win them over and not be arrogant.
That's a good agreement. AB, I think you have a question.
Yes. So I think it's slightly related to what Natasha just asked. And I've been reading a bit about how, you can put forth arguments that can convince people. And there's always this concept of putting forth evidence, experimental evidence, empirical evidence that says what you want to, but at the same time, couching that in the way of a narrative or a story that helps to convince them that what you're trying to say is something that they need to be invested in. I guess what I'm trying to ask is, so you are still doing some amount of research and stuff, right? And then do you use this directly, or do you have to, tailor it to the community that you're approaching? And if so, how much do you weigh providing these empirical evidence using methods that may be not accessible or understandable to the community, as opposed to stating it in a way that is more easier for them to get an idea of, but has less, say, facts in some sense?
Yes, that's a great question. How do you translate the research we're doing, into change at the community level? And we try our best to do that. Like as I mentioned with the study of Giardia and Cryptosporidia in the people who are gorillas and livestock, but also even just with our regular monitoring, like if we find that gorillas are picking up human parasites or livestock parasites, it's not enough to make sure gorillas are treated because the parasites are making them sick. But we also try and treat the people, working with the local health centers, and we try and treat the livestock as well. We deworm the cattle, and it makes people feel like you're giving them a service, but at the same time, it's reducing the threats to the gorillas. And over time, we're seeing, as we deworm the people and the livestock in areas where gorillas are picking up parasites, either by going into community gardens, ranging, especially when they range in community land, this is resulting in less human and livestock parasites in the gorillas. So that's just like a really basic one. We come up to them and say, what? But of course, before we treat them, we also take samples from them and we say, we're taking your sample and we're doing it for a reason. We're going to come back and treat you. Because also community members are tired of researchers collecting a lot of information from them, even biological samples, and they never come back with the results. And I think it's a very big problem with a lot of research and researchers, like even locally, but we're showing them that, look, we've taken your sample and this is the result. No, we didn't find any worms, but this is how we're trying to address it so that you're better off and the gorillas are better off. So it's some of it is really simple like that, but some of it is not as simple. It just depends. Some of it, like I'm trying to think of something that we're trying to find out as well is, since we started Guerrilla Conservation Coffee to support the coffee farmers, how is it resulting in reduced poaching? It's difficult for people to tell you they're poaching because they'll get arrested. So sometimes it's very difficult to conduct such research because it's an illegal activity. But some certain researchers have found out a method called indirect questioning, where you basically, you don't say, are you doing it? You say, are people poaching in your community? Are people poaching in your village? And they'll normally say yes. When they say yes, actually what it means is they're poaching. But they don't want, it's not them, they don't want to say I'm poaching, but there's poaching in my community. So then you get, it's like an indirect way of finding out what's happening and whether what you're doing is having an impact. I mean, it's not as simplistic as that, but there are other statistical methods that go into it. But it's generally, people don't want to say I'm doing something. They'd rather say somebody else is doing it, which basically means they're doing it, but it's them. It's really them doing it. But it's a way of doing it that you're not accusing them, and then you come out with what you need. So there's a lot of that as well, just finding different ways. Of course, working with sociologists and anthropologists is very important, to work with anthropologists as well. And that's the beauty of One Health, is it's not just, you have to work with people from different disciplines. It's not just medical doctors and veterinarians, but you also have to work with conservationists, sociologists, anthropologists, you name it, even tour operators, so that they can carry out responsible tourism to Great Apes and educate their tourists before they arrive. So there's a whole range of people you end up having to work with in the One Health approach.
I was wondering, are you contacted by many people wanting to do the same kind of thing as you did with gorillas, but in other country and another species?
Yes,
That's
actually,
nice.
we've worked with I gave a talk in India one time at the Science Conservation Conference in Bangalore, and somebody came up to me, people came up to me and said, this could really work with tigers, reducing human-tiger conflict in India, because just showing people that we are here to improve your health, and improve the health maybe of your animals, it already makes people feel more positive towards you. And then you can talk about ways that they can address the human-tiger conflict. So they were really excited about it. And the person who got me to speak also won an Whitley Award like me, Dr. Madhu, and he said that he liked the fact that our approach is helping to bridge human need and conservation concerns. So he really wanted me to speak to, his peers in conservation in India. So that was I really enjoyed going to that conference. Also because they had, half the people who came to the conference were women. Oh. Which in Uganda, normally it doesn't happen like that. Like it's just a small minority. Women are always the minority. And a lot of them were like, it was exciting actually. And a lot of them were really happy to hear me speaking, because they said, we often hear people coming to speak to us, and they're even talking about wildlife in Africa, but they're not from Africa. But you're from Africa, you're speaking about your wildlife, and you're a woman. So they were really excited about it. And actually one of them came over to Uganda and did a study with us. She's still in contact with us. And she recently interviewed me for a podcast, because she became a wildlife veterinarian because of spending time with us. And so I think it's also important to do that cross-country, south to south collaborations. I think they really help, because I was inspired. I'm like, wow, so we could actually have 50% conservationists being women if the Indians, if they've been able to do it in India. Of course, conservation has been going on over there for longer than Uganda, but at least it's something that we could aim towards, because it was nice to see that actually.
And with talking without people trying to do the same thing as you, do you have like ideas from them that you try to put in your own research, or?
Yes, we do. We've worked with different kinds of people. Like the model household approach is something that we adapted from, we were on a certain project where we were at it was a consortium and funded by the David and Lucille Packard Foundation and MacArthur and USAID. And in it, they were using things like clean energy cook stoves as an intervention, which they called PHE intervention, population health environment intervention. So we adopted some of that and we started promoting clean energy cook stoves in the communities where we are. And also I liked the fact that they got us to be involved because they liked the fact that we're turning community health workers into community conservation health workers. So village health teams into village health and conservation teams, which is highly scalable anywhere in the world. But then also we liked the fact that everyone came up with this whole issue of model households, like Ecological Christian Organization were like, let's get a home to be a model home and other homes become like that. And so that's kind of what we're doing right now. We basically got all that we're doing to then created model homes. And so, yes, we do adapt things from different people. Currently, right now, we are collaborating with partners in Kibale National Park, where there are chimpanzees, and Budongo Forest, where I first went as a vet student. And we're trying to look at how we can jointly do great ape health monitoring. You know, with the Jengudo Institute, the Kibale Eco Health Project, the Kibale Chim Project, and Florida International University. It's been funded by ACAS Foundation. We're trying to harmonize great ape health monitoring and responsible tourism to great apes so that it's wherever tourists go, they know we're going to find the same kind of set of rules, and which is better because we're reducing the risk of disease to the great apes, but also people getting harmed because, you know, these are potentially dangerous animals. But then also at the same time, we're doing comparative studies, you know, looking at bacterial viruses in all of them, respiratory viruses, intestinal viruses, respiratory viruses. And most recently we found in Kibale, they found that a lot of the field assistants and researchers at the research site, Kibale Eco Health Project, Dr. Tony Goldberg found over the years that whenever children went back to school, beginning of term, a month later, the chimpanzees would be coughing and sneezing. And the reason why is because the children will go back to school, pick up colds from their fellow schoolmates, give it to their dads who are working in the national park as rangers or field assistants, and then they would give it to the chimpanzees. And so what's the best way to address this is by reducing these outbreaks in schools. And so the same thing at Bwindi, we've just published a paper together, which I'll share with you after the webinar. And the paper just came out like, I guess, 2 weeks ago. And it's talking about, because what we did is we collected samples from people around Bwindi who are more likely to who have children who could give them diseases, and they work with the animals. So we collected similar kinds of samples from people in Bwindi, in Kibale National Park, Budongo, and also I think Bulindi. And so with that, we came up with a paper, which basically came up with a whole range of viruses which people have, which could potentially go to the great apes. And then more recently, we also published a paper with the people who I talked about in my presentation, who I did research with. We just published a chapter in an eco-health book talking about how tourism has changed over the years and how all these regulations have developed and how they need to keep developing. Because I remember the first time we mentioned that we need to be wearing masks when we visit gorillas, some government officials were concerned. They said, what if the gorillas run away because you're wearing masks? We're like, okay, so there's one time I did wear a mask and they didn't run away. They were actually more curious. And I said, but this is all about protecting the gorillas from our human diseases. And so people wearing masks has not stopped gorillas they've not run away. In fact, sometimes they're more curious. And so it's all about sharing these lessons and showing that actually when we interview tourists, they're willing to wear masks and they're more willing to wear masks. They're like, okay, then we can implement this government policy because we're not going to lose tourists because we need the money from tourists to support conservation efforts. So it's just trying to bring everybody together. And that's where research really makes a difference.
Thank you for this. Yeah, I guess this is the end of our Meet the P session with you, Gladys. I guess you might have more questions on Discord if you are able to check. But yeah, thank you very much for your plenary talk. Thank you for this session. It was super nice and very inspiring. And yeah, we need to read more about your work. Thanks a lot.
Thank
and
you.
I hope
Thank
you
you so
come over
much.
to Uganda. I hope you come over to Uganda and visit.
Oh, it would be perfect.
And see
I would love
in
this.
action. See the
I would
gorillas
love
meet
this.
see our work in action. That would be really nice. And
Thanks
are you
a
going
lot.
to have a recording of this so that I could share it with my team afterwards?
Yes. Yeah,
Okay.
Abby, can you answer maybe?
Yeah, so usually once the live is done, you can watch it in the same link for 2 weeks, and then once the 2 weeks is over, we'll cut out the videos and make sure everything is like all the videos that have been made public will be available on its own link. So after 2 weeks, you will have a link just for this video, just for this session. Yeah.
Great.
We'll send
I'll
it
get
to
my
you.
team, because not all of them have been able to see it because of the timings and everything, but
Yeah,
that
sure.
would be great.
So thanks a lot. You can leave the session now. Thank you again, Gladys. It was super nice to have you with us this year.
Thank you so much, Lore and David.
Thank you.
I'm used to Natasha and George.
It's Natasha, it's fine.
Okay. It's great to meet you all, and hopefully we'll see you in Uganda if I don't see you in another part of the world.
Right.
Okay,
Bye.
thanks.
Bye.
Bye-bye.
Bye.